Today we are conducting saliva tests for faculty, staff, and students. It's just contact tracing to ensure that we don't spike our numbers for positive cases here on campus. As someone who gets to serve not only my fellow students, but the staff members that work so hard to make sure that UIC continues to run smoothly during these unprecedented times, I do feel that sense of pride, not only for myself, but also my peers who are working beside me.
Well, I mean, it's a positive feeling. You know, you are helping everyone. We're trying to get people back. We want to get students on campus. As a former educator, I know that it's important for students to be in the classrooms, and we can start to hold those types of events that we normally do, convocations, graduations. But in general, I usually walk away every day thinking, you know, good, there's another set we've got done.
Through this job, I've been able to not only gain real patient interaction, but I've been able to do something that I feel is very meaningful for the community. Initially, when we opened up the COVID testing, I was there when the chancellor came in, and he had told us on the side, because of what we were doing, they were able to keep the school open and people were still able to get an education. I just really wanted to go and help people. It sounds really cheesy, but...
So I'm from Texas, and I was back home during the first 2 months of Corona, and I was back in Chicago in May because I wanted to help out in my community, and Chicago is a place that is my new home. None of my family, they actually encouraged me to apply for this. They weren't too worried about me. I was more so worried about my mom in particular, because she works in hospitals, and she was actually diagnosed with COVID and had it pretty bad. So just knowing that I'm able to help the same community that she is a part of is very reassuring to both of ourselves.
I enjoy that we are providing this service, and I also like that, watching the students who are involved in providing this as well. And a lot of those are nursing students or students, in a healthcare profession. And, this is obviously helpful for their career. And, so watching a whole lot of people come together to make this happen. The greatest part, and not so much now, but when we first started, a lot of people, have problems, producing this much saliva. And especially your first time, you're really nervous. People are watching you and, just trying to calm people down, let them know it's okay, take your time. So yeah, bonding with people in a, weird manner, but, yeah, people are appreciative, just helping them make them feel comfortable. It feels great to be a part of, the solution and keeping our rates at UIC down. And yeah, it feels really good to be a part of it.
It is nice to just sit back and think about the fact that we're helping, detect and catch early cases, making sure things don't spread. It's nice. It's nice to really think that we're doing something important. We're making sure UIC is being able to operate, giving everyone a little bit of peace of mind.
So we're at the Credit Union 1 Arena, and we are vaccinating 1,000 people. And we've been doing this since February, early part of February, 1,000 people a day, 5,000 a week. In January, we were approached by UI Health to partner with them on becoming a vaccination site. We think our venue is perfect for it. The way we set it up is easy for people to get in, get registered, get their vaccine, go through the waiting period and out. We realized our role was extremely important in keeping the university safe. So with the saliva testing, we're identifying people that are asymptomatic and getting them out of the general population. And for us, that was critical to make sure that the university operated. A lot of people ask, well, why do I need to continue to be tested if I've been vaccinated? And as a research institution, what we are trying to determine is how effective are the vaccines? We want people who are vaccinated to continue to give a saliva sample so that we can test that and make sure that people that are vaccinated truly are 95% vaccinated from the disease. This is an important thing for not only the university, but the world, and we are just thankful that UI Health and the Chancellor's Office thought highly enough of us to take this over for them.
With the saliva testing and the vaccinations, students are feeling more safe on campus, and you can see that. And so I feel like if I'm creating this better environment, then it's worth it to wake up at 7:30 a.m.
We were all very nervous because events weren't exactly happening last year. So we got approached and they said, hey, we need to have these saliva testing sites so we can test students and make sure we avoid clusters and outbreaks on campus. And think everybody in the department really stepped up and said, okay, yeah, here, we're here to do it.
I remember initially when we first started, this is about a couple months ago now, when we very first started vaccinating only critical, like, at-risk individuals, the elderly, people with underlying conditions were the only ones being able to vaccinate. And we simultaneously had our UIC Athletics men's basketball program operating here and women's program. And they were practicing on the floor and simultaneously had patients who had just received their vaccine in our waiting area. And they, many of these people who were, fearing for their lives couldn't leave their homes for a year or more. And they finally were able to step out of their homes, get a vaccine, and they got to see live entertainment, inadvertently live entertainment at the same time. And many of them were got very emotional, were crying in our waiting area because they felt that this was like the next step of their life. So yeah, I mean, we're really happy to hear stories like that, that people can not only efficiently be taken care of, but that they have a positive experience overall.
I feel nervous about going into nursing and being educated during COVID, and I wanted to get more experience, more contact with people, and really get a feel for what I was going to be doing as a nurse. And this seemed like a great opportunity to, help my community, do something that's really important that we need to do and need to have done quickly. Everyone has so many emotions, and I think remembering that we've all been through this huge trauma of COVID, and remembering that anytime someone's going to come into me for a vaccine again, or is going to come to me for some other sort of care, remembering that everyone's at a different place emotionally, physically, mentally, spiritually, and really meeting my patients, getting emotional, meeting my patients where they are and what they need, and making sure I provide for all of their needs. I had my first child in January of last year. We had all of these plans. We were going to go meet all of my friends, all my family, all my wife's friends and family, and all of these, they were supposed to have this huge family that loves them. And they still do, but it's from afar. And I'm so excited for my kid just to meet all of these people that love them so much, and to have all of these experiences in their life, and just to have them be a kid and do normal kid things and not have to worry about getting sick. I had another woman come in and she gave me her name and her date of birth and just started bawling, and was just so overcome with emotion to feel like we're making this progress, and maybe her life can come back, and she mentioned she hasn't seen her parents in forever and she just misses her family. And to know that I'm helping people get close to the things that they're missing is just so heart-touching, and it's a great emotion.